You know, if we're honest with ourselves, the health of our bodies and the health of our planet are not two separate struggles. Most people overlook this quiet truth. Every hospital light that burns, every single use device that fills a landfill, every chemical we pour into the system, it all circles back, touching the very lives we aim to protect. We spend our days thinking about wellness, about care, about healing, yet the systems we build to preserve life sometimes leave scars on the world that sustains it. And that's the paradox we inherit. How do we care for ourselves without failing the earth that cradles us? How do we honor life while preserving the world for those yet to come? When I think about the era we live in, the early decades of the 21st century, it's impossible not to see the collision of health and environment. Around 2010, hospitals and clinics began to recognize the unintended weight of their own operations. Emissions that cloud the air, waste that seeps into our rivers, energy consumption that drains resources at an unprecedented pace. At the same time, chronic diseases were on the rise, inequities in care were growing, and our global climate was shifting beneath our feet. In that moment, the moral responsibility became undeniable. Health could no longer be considered in isolation. Leaders, doctors, policymakers, and communities faced a choice: continue along the path of short-term care or imagine a system where sustainability and wellness are inseparable. Courage appeared not just in medical breakthroughs, but in decisions to redesign entire hospitals, to invest in green energy, to rethink how we measure quality and progress. It was messy, it was uncertain, but it was necessary. And in that struggle, hope found its quiet voice. I remember organizing in Chicago, walking block after block, listening to families talk about illness and survival. I remember the frustration when patients lacked access to basic care, the subtle despair of knowing we could do better. Sustainability felt like a far-off concept then, something distant, abstract. But in the Oval Office, the connections became undeniable. The same communities most affected by poor healthcare were also most vulnerable to pollution, climate events, and environmental hazards. It became clear that leadership wasn't just about passing legislation or funding programs. It was about seeing the intersections of human and planetary health, about asking the hard question of what justice looks like when a child's asthma is fueled by the air outside their window. And let me be honest, the work was slow. It always is. There were moments of doubt, of skepticism, even fatigue. But the persistence of ordinary people, nurses who advocated for greener practices, engineers who rethought building designs, community leaders who pushed for equitable access, they reminded me that progress is built incrementally by many hands over many years. Sometimes you just have to trust the process while never losing sight of the urgency. And so I reflect on what it tells us about human nature. We are capable of remarkable care, yet we are prone to short-sightedness. We can innovate, heal, and dream, but we can also overlook the ripple effects of our actions. Democracy, in its best form, asks us to do both, to act with courage and conscience, and to hold one another accountable to the long-term good. Leadership in this era of health and environment is a balancing act between comfort and challenge, between immediate need and future consequence. It requires humility to admit that no single policy, no single breakthrough is sufficient. It demands imagination to see a hospital as both a place of healing and a steward of the environment. And it insists on justice, recognizing that sustainable healthcare is not merely a technical pursuit, but a moral imperative, linking equity with responsibility, care with conservation. There is a paradox here too. The very systems designed to save lives can, if left unchecked, imperil them. And yet, with courage we can bend that arc toward resilience, toward a world where the health of people and planet rise together. So we are left with the task, the responsibility, and the opportunity to act deliberately. Every decision about energy, waste, procurement, and design carries weight far beyond the walls of any clinic or lab. The path forward is incremental, collaborative, and persistent, but it is achievable. And in that quiet work, we honor more than patience or policy. We honor life itself. We ask ourselves, how will the choices we make today shape the world our children inherit? What burdens can we lift by thinking not only of care, but of stewardship, not only of survival, but of flourishing? Can we cultivate a healthcare system that heals without harm, that uplifts without exploitation, that embodies justice and foresight in equal measure? These are not small questions, but they are the ones that define our generation, and they are the ones that will measure the integrity of our leadership and the compassion of our shared humanity. Every step we take toward sustainable health is a step toward dignity, resilience, and justice for people and for the planet we cannot live without. Don't forget to like, give a thumbs up, and turn on notifications so you stay up to date with these engaging health talks.